Hi friends, let's solve few of the multiple choice question on congenital diaphragmatic hernia. What pulmonary changes are associated with bochdalek hernia? Respiratory distress syndrome, pulmonary hypoplasia, pulmonary edema, or meconium aspiration. We all know that congenital diaphragmatic hernia is a defect in formation of diaphragm which allows abdominal organ to push into the chest, leading to lung hypoplasia and pulmonary hypertension. There are several types of CDH. Among all, bochdalek hernia is the most common and accounts for more than 95% cases of CDH. This hernia takes place through the posterior triangle, and this triangle is situated between the lumbar region and the costal region of the diaphragm. This triangle is formed due to incomplete fusion of pleuroperitoneal membrane, and herniation through this is called bochdalek hernia. There are fewer alveoli, thickened alveolar wall, and increased interstitial tissue, and markedly reduced alveolar airspace as well as gas exchange surface area. So, severe developmental arrest of airway and vessels resulting in lung hypoplasia. So, now our question is what pulmonary changes are associated with bochdalek hernia? Respiratory distress syndrome is named for a hyaline membrane disease which is associated with prematurity where there is an absence of surfactant. Pulmonary hypoplasia is our answer to this question. Pulmonary edema is not seen here. Pulmonary edema essentially is seen in patients who are having a cardiac failure. And meconium aspiration is also not seen along with bochdalek hernia. So correct answer to this question is pulmonary hypoplasia. Next question is, why would bag and mask ventilation be contraindicated in resuscitation of a newborn with CDH? A. It results in air swallowing which enlarges the stomach and compresses lung tissue. B. It requires too much efforts for respiratory therapists to manually squeeze the bag. The FiO2 delivered by device can cause oxygen toxicity. The high tidal volume may result in pulmonary interstitial emphysema. To know the answer to this question, we should understand that while we squeeze the bag to deliver the intermittent positive pressure, the air will, through bag and mask, air will go to trachea as well as esophagus both. Now in a normal patient without any anatomical problems of trachea and lungs, this air will go properly to the lungs and it will replicate the action of breathing. Whereas in case of diaphragmatic hernia, where there is a lung hypoplasia and many of the intestinal organs are in the chest cavity, whatever air is getting pushed through trachea and esophagus, the air which is going to esophagus will come to the stomach, which is in the pleural cavity here. It may fill the displaced intrathoracic viscera with air and it will worsen the respiratory compromise because. So correct answer to this question is option A. It results in air swallowing which enlarges the stomach and compresses the lung tissue. Rest all other options like requiring too much efforts or oxygen toxicity is not relevant and it's not correct. The next question is, all of the following anatomic alterations may be found in a patients with congenital diaphragmatic hernia except A. Lungs are compressed, B. Atelectasis, C. Hyperinflation, D. Complete lung collapse. So in congenital diaphragmatic hernia, lungs are compressed because the chest cavity is occupied by intestinal organ on the side of herniation. This will further cause atelectasis and it can also cause collapse of that lung. However, hypoinflation is not seen in congenital diaphragmatic hernia. Rest all three, starting with the compression of the lung, atelectasis and complete lung collapse, could be observed as anatomical alterations in a patient of congenital diaphragmatic hernia. So option C is answer. In the delivery room, which of the following are recommended to manage a newborn with CDH? 1. Administer oxygen. 2. Begin bag and mask ventilation. 3. Intubate and ventilate the newborn. 4. Insert nasogastric tube and keep it open. So let's learn what are the steps of managing newborn in the delivery room who are born with the diagnosis of congenital diaphragmatic hernia. So first step is no bag and masking. If the baby is having distress and cyanosis, immediate intubation if required. Nasogastric tube placement should be done to remove excess of air. So correct answer to this question is administer oxygen, intubate and ventilate the newborn, insert the nasogastric tube and keep it open. It's combination of 1, 3 and 4. So correct answer is option D, 1, 3 and 4. question. All of the following chest radiograph findings would be associated with CDH except stipple point sign, complete lung collapse, heart is shifted to the unaffected side, ball loops are seen on the affected side of the chest, abdomen is relatively devoid of gas. So let's learn that what are the radiographic findings of CDH. Ball loop seen on the left side of the chest. If you see the mediastinum, it is shifted to the right side. Abdomen is relatively devoid of gas. B, C, D and E. These four findings could be associated with CDH but not the stipple point sign. So stipple point sign or wine bottle sign or inverted V sign refers to the tapering of the upper trachea on chest radiograph. This sign represents glottic and subglottic narrowing of the airway, which is typically seen in children with croup. Hence, stipple point sign is not associated with CDH. Next question is, which of the following is described as an abnormal elevation of an intact diaphragm into the chest cavity? Diaphragmatic altimetry, diaphragmatic eventration, morgagni hernia or bochdalek hernia. In the beginning of this video, we have discussed about bochdalek hernia, that it is a defect in a pleuroperitoneal membrane of the posterolateral part, which is known as a bochdalek triangle, posterolateral triangle or lumbocostal triangle. It's a defect from where the herniation of abdominal content occur. On the other hand, morgagni hernia is anteromedial defect of the diaphragm, and these are small natural gaps between the external origin and costal origin of the diaphragm, and this is natural weakness in the anteromedial portion of the diaphragm, which is caused by the passage of the internal thoracic vessels. They pass from the thoracic cavity through this diaphragm into epigastric region, where they become superior epigastric vessels. Now, what is diaphragmatic eventation? It's just abnormal displacement or elevation of part or all of an otherwise intact diaphragm. Here there is no defect in a pleuroperitoneal membrane. It's just a part of diaphragm which is elevated, and this occurs because of incomplete muscularization of the diaphragm. So back to our question. So option A, diaphragmatic altimetry, it's not a proper medical terminology, so this option is not correct. Diaphragmatic eventation is correct option, while option C and D is intact diaphragm, it's actual defect. So correct answer to this question is diaphragmatic eventation. What happens as an infant with CDH creates an increased negative inspiratory pressure in order to breathe? Options are meconium is drawn deeper into the airways, lung compliance is improved, more of the gastrointestinal structures are sucked into thorax, or lungs fill and expand to full capacity. Here the explanation remains same as we discussed in the beginning of the video. Whenever infants breathe in, air goes into the lung as well as esophagus. If newborn takes very deep breath, air also passes to the esophagus and it will again fill displaced intrathoracic viscera with air, which will worsen the respiratory compromise. Option A, CDH is not as same as meconium aspiration syndrome. Lung compliance is not going to improve until the patient is intubated and provided ventilation through the intermittent mandatory ventilation. Option C is correct because more of the structures are sucked into the thorax because of creating a negative pressure. D, lungs fill and expand to full capacity, which is not going to happen because it's a developmental defect of lung where lungs are hypoplastic. So correct answer is option C. So that's all about today's MCQs. Thank you for watching this video. I hope you all understood and learned well. Please let me know what other topics you would like to learn from me.